has our coronavirus updates. Dr. Mike, good morning. How are you doing?
I'm doing just fine, Pilar. I can see light at the end of the tunnel. How do you like that?
I definitely like that. What sort of light at the end of the tunnel are you talking about, Dr. Mike?
We have new vaccines coming. The Johnson&Johnson vaccine is going to be put up for emergency use authorization, and we're hoping that that will be a third vaccine that we have to give to people to end this pandemic.
Dr. Mike, one of the things that I don't know if you want to say I'm excited about, but I'm optimistic about the fact that the Johnson&Johnson vaccine is expected to be just one dose, right?
Well, there's a couple advantages to this vaccine. Number one, it's a single dose, as you said, which is a real game changer because you don't have to worry about bringing people back. Secondly, it can be kept at regular refrigeration temperatures, which means that it can be in doctor's offices like mine. You don't need special equipment, and especially for rural communities who may have limited access to hospital centers, this is a game changer again because it can be given to people. And remember, the way we're going to get rid of this virus and to stifle, to reduce the number of variants, those mutant viruses that are coming about, is to immunize as many people as possible.
Is it true, though? I thought I heard reports about the Johnson&Johnson vaccine not being nearly as effective as the Pfizer and Moderna one.
Well, when you look at the data, you have to think about it and analyze it carefully. What do you want a vaccine to do? You want it to keep you out of the hospital and to keep you off a ventilator and ultimately keep you from dying. And that is what the Johnson&Johnson vaccine does. 85% effective. When you look at flu shots, when you look at any other kind of vaccine that we give to people, this is amazing data. When you compare it to other vaccines, you have to remember that these variants are taking a hit and a toll on all of the vaccines. And we're hoping so far that all three of these will have an impact on these variants. This vaccine does have effects on the South African variant, not as good as we've seen with other areas, but it is still effective, and that's what we want.
There is some new information coming out of the UK regarding research being done on mixing and matching vaccines. A new study will be looking at combining one dose of the Pfizer vaccine and one dose of the AstraZeneca vaccine in patients. There's even talk about using the Russian Sputnik V vaccine. What are your thoughts on this, and what benefits may be derived from doing this?
Well, Pilar, the bottom line is we need to vaccinate as many people as we possibly can, as quickly as we possibly can. And how better way to do that than to have the ability to mix and match? There may be an area where there's more Pfizer vaccine. There may be more Moderna vaccine. There may be not enough of one or the other. Wouldn't it be an option? Wouldn't it be a great option to be able to mix and match? That would help us with the logistics of this vaccination process. Remember, so far, it's more of a distribution problem. We've got, at least in the United States, we've got the ability now to mass vaccinate. We just need product. We need the vaccine. And if we can mix and match to get those vaccines to the people, it's going to help everyone involved.
Dr. Mike, the CDC says schools can reopen even if teachers aren't vaccinated. What are your thoughts on this? Especially, I'm sure you've heard about what's happening in Chicago.
Well, here's the problem that you have, and I call teachers first line responders. You've got these folks putting their lives on the line, and they are teaching our children. This has to be priority one. Now, maybe because I'm an only child, Pilar, I want my cake and I want to eat it too. So the bottom line is, let's vaccinate our teachers, get them safe. And we know from the data that especially with younger children, if you do it right, if you get them to socially distance, if you limit the numbers, if you test them on a regular basis, then you can open schools safely. I think justifiably so, that teachers have concerns. I'm a frontline provider, and it definitely has taken its toll on me since March. I think we ought to make it an emphasis to get our instructors, our teachers, our staff, school staff immunized. Let's go. Let's roll it out and get our kids back to school, because that is critically important. Remember, Pilar, there are problems with not having our kids in school. I have 2 young children myself, and it is taking a toll. The social isolation is a problem. What we need to do is do it right. Let's get vaccinated, get the kids back to school, and let's move on. That's my humble personal opinion.
Dr. Mike, we keep hearing that the overall infection rate is dropping here in the U.S. What advice do you have for those planning to have parties this weekend for the big game?
Well, in Philly, I talk like this: forget about it. All right. It's all great. I want to be with my friends. I want to watch the game, but you don't want to lose loved ones because you did something like this. It's just not the time. I'm telling you, Pilar, when this thing is done, when this pandemic is over, there will be so much partying. It'll be hard to go to work because there'll be so much partying. So right now, we need to just chill out. Have people on the phone, have people on Zoom, keep them on during the entire game so that you can be in the presence of people without the risks, because you don't want to lose a life over a game.
Dr. Mike, a new study of 40,000 people found that 1 in 3 had mild side effects like a sore arm from getting the vaccine. Many are still concerned about side effects and safety. What advice can you give individuals who are on the fence?
If you want to get out of this nightmare, you need to get a vaccine. If you vaccinate the multitude, then you will have herd immunity. And this study is so important because the major side effect was a sore arm. I got the vaccine. Yes. Did I have a sore arm? I did, for about 12 hours after the second shot. Did I feel a little achy? Yes. Did I have a low-grade fever? Yes. But I'll tell you what, Pilar, I'd much rather have that for 12 hours than be on a ventilator suffering from COVID-19. So for everyone out there that's on the fence, do it for yourself, your loved ones, your friends, and let's get out of this nightmare.
Yeah, a sore arm after a shot isn't anything new. I remember getting my vaccines as a kid and sitting in a food court at the time because I got my vaccines at a mall with a sore arm, just crying to my mom. So when you think about what could happen as a result of a vaccine, that's really not too bad, huh?
I've been dealing with COVID-19 since March of the last year, and I got to tell you, you don't want to mess with this virus. This is a bad actor. Let's get going, get vaccinated, and we will get through this.
Dr. Mike, while I have you, I do want to ask you really quickly about long-term effects of COVID-19. What are we seeing in those who have had it and have recovered months down the road?
Well, they're called long haulers. And Pilar, I've seen it in my own practice. People are suffering, a lot of them. In fact, there are studies out of Wuhan looking at the numbers are dramatic in terms of people that have long lasting effects from this virus. And for those who say, well, I'll just get the virus and be done with it, I don't want those vaccines. You have to remember that there are consequences of this virus, long-term effects, and much of this we still don't know about yet. So best news, best idea, best advice, don't get the virus. There you go.
All right, Penn Medicine's Dr. Mike Cirigliano, thank you so much for joining us live here on News Now from Fox, and have a great weekend.
You take care, Pilar. You're the best.
Taking a live look now, everybody, at Philadelphia, Pennsylvania. Look at the snow on the ground out there. More News Now from Fox is just moments away.